No, this can be a sensitive topic, but the goal here is to break it down in a way that is super simple and easy to understand. Whether you've had myths, are curious, or just want to know the facts, I've got you covered. We are going to talk about what abortion actually means, the different types of abortion, both natural and medical, and your options if ever you find yourself in such situation. So grab your drink, get comfy, and let's get into it. Hi besties, welcome back to Mercy's Wellness Diary, your go-to channel for all things health, food and wellness. Here we explore simple tips for a healthier lifestyle, share delicious recipes, and dive into wellness hacks to help you feel your best every day. I am here to break down everyday health topics and make them simple and fun, from common health conditions to staying on top of your wellness trends. So if you are ready to learn, laugh, and level up your wellness journey, hit that subscribe button. Like this video and don't forget to join our community. Okay, first things first. In simple terms, abortion is when a pregnancy ends before the baby can survive outside the womb. Sometimes it happens naturally without anyone doing anything. This is called a miscarriage. Other times, abortion is done intentionally, either with medicine or a minor procedure. So basically, we have two main categories. Number one is the spontaneous abortion, which is when it happens naturally. That is the one we call miscarriage. And second one is induced abortion. This is when it is done on purpose, either with medication or a surgical procedure. Let's break down the different types of abortion that happens naturally. If you ever had terms like miscarriage or threatened abortion, this is what they mean. Number one is complete abortion. This means everything has come out of the uterus naturally. You may experience bleeding and cramps, but once the pregnancy tissues is out, things settle down. Number two is incomplete abortion. Here, only some parts of the pregnancy come out and some remain inside. This can cause ongoing bleeding and may require medical help to clear everything completely. And this is where we talk about D&C. The third one is mixed abortion. In this case, the pregnancy stops growing, but the body hasn't expelled it yet. Sometimes you don't even realize it until you go for a scan. The fourth is threatened abortion. This happens when you experience bleeding and cramps, but the pregnancy is still holding on. If treated early with rest and medication, it might continue successfully. The fifth one is inevitable abortion. This means the pregnancy cannot be saved because the cervix is already opening and heavy bleeding is happening. The sixth is septic abortion. This is when an infection occurs due to an unsafe abortion or incomplete miscarriage. It's a serious situation and needs urgent medical attention. Now let's talk about abortions that are done on purpose, also known as induced abortions. These are usually done when someone decides to end a pregnancy for personal or medical reasons. There are two main ways this is done. Number one is medical abortion, the pill option. This is done using medications to end the pregnancy. You take two types of pills. The first one stops the pregnancy from developing, and the second one causes the uterus to push out everything. It is usually done in the early weeks of pregnancy, up to 10 weeks. It feels like a heavy period with cramps and bleeding. Number two is the surgical abortion, the in-clinic option. This is a simple procedure done by a doctor to remove the pregnancy tissues from the uterus. It's quick, usually done in less than 30 minutes. The most common method is suction, which is used for early pregnancies, while later pregnancies might need a different method. You can go home the same day and rest. Now let's talk about how you can choose the right options. Choosing between medical and surgical abortion depends on a few things. like how far along the pregnancy is. Pills works for early stages, surgery is for later stages. Whether you prefer to do it privately or at home or with a doctor. Any health conditions that might make one option safer than the other. But whatever choice you make, always talk to a medical professional for the best advice. Let's talk about what to expect. Let's be real. Whether it is a pill or a procedure, you are going to experience some changes in your body. Here is what to expect. If you go for a medical abortion, which is the pills, expect heavy bleeding, cramps and tiredness. You might see clots and tissue pass out, which is normal. The bleeding should slow down after a few days, but spotting can continue for a couple of weeks. If you go for a surgical abortion, expect some mild cramping after the procedure. You would likely feel better in a few days or weeks. You might have light bleeding, but it won't be as heavy as the pill option. Okay. Let's clear up some common myths about abortion because there is a lot of misinformation out there. Number 1, abortion makes you infertile. No, a safe abortion done correctly doesn't stop you from having kids in the future. Number 2, it is extremely painful. It can be uncomfortable, but pain relief options are available and it's manageable. Number 3, you have to stay in the hospital for days. Not true. Most abortions, whether medical or surgical, allow you go home the same day. Now let's talk about taking care of yourself after an abortion. After an abortion, it's important to take care of yourself, both physically and emotionally. Here are some tips. Rest as much as you can. Your body needs time to recover. Drink lots of water and eat healthy meals. Avoid heavy lifting and strenuous activities for a few days. Listen to your body. If something feels off, see a doctor. It's not just about the physical part. Abortion can bring up a lot of emotions. Some people feel relief while others might feel sadness or guilt. And guess what? It is totally normal. Talk to someone you trust or seek support if you need it. You don't have to go through it all alone. Alright besties, that is it for today's video. I hope this helped clear up any confusion about abortion and your options. Remember, it's all about making informed decisions that are best for you. If you found this video very helpful, please give it a thumbs up. Share it with someone who might need it. And don't forget to hit the subscribe button for more easy to understand health contents. Thank you for watching. Stay informed, stay empowered. See you next time. Bye.